Just as a preliminary to the topic itself, just touch very briefly on ovarian hyperstimulation and a summary of its effects. Basically, it's a massive fluid shift from the intravascular compartment to the third space, and this results in profound intravascular, go back there, depletion and hemoconcentration with excessive fluid accumulation, and this leads to all the symptoms that we know commonly, like bloatedness, breathlessness, and deep vein thrombosis. And all this is due to increased vascular permeability. The severe form is life-threatening and hopefully not lethal nowadays with good management, and we want to prevent this, and it occurs in about 0.1 to 2% of ART cycles, higher incidences in the high-risk group, of course. There are two forms, the early form and the late onset form. And the early onset form is associated with the ovarian response, and the late onset form with the pregnancy-induced HCG. So for today, we are going to talk on the early onset form, because that is where the coasting has thought to have an effect. Now, there are various preventive measures for severe OHSS, and I'm not going to talk on that in this lecture. They all act at different levels in the pathway, and none of them have absolutely prevented OHSS, except perhaps cancellation of the entire cycle. And for today, the area we are going to concentrate on is coasting, and that is stopping the gonadotrophin injections until the serum estradiol level reaches a threshold that you have decided for your center or your population, and that is safe enough to then continue the cycle by triggering ovulation with HCG and continuing with the egg collection. The list here is by no means extensive, and there are several other measures that have been introduced.